My name is Catherine Longo. I'm a registered nurse here in the United States. Today I'm doing an educational video on otitis externa or on swimmer's ear. So first I'm going to give you a case study, or it's an example of a patient that's come into a clinic. So Jay is a 17-year-old high school student who's on the high school swim team. He presents with sudden onset of right ear pain that worsens at night. He says the pain intensifies when he touches his ear and he has a feeling of fullness in his ear. On examination, the auditory canal is edematous and a feeling of fullness. He has a feeling of fullness in his ear. On examination, the auditory canal is edematous and with yellow crusting. His temperature is 98.7, and his tympanic membranes are pearly with landmarks intact. The patient has been prescribed eardrops that a family member will be administering for him. So Jay, from this example, has something called otitis externa or swimmer's ear. In your ear, you have an ear canal that connects your outer ear to your inner ear. This little canal, you can see in this little diagram, right here, right here, is covered with soft tissue. In the case of otitis externa and swimmer's ear, this tissue becomes infected and inflamed and starts having a bunch of processes going on. The ear canal is a very moist, warm tube, and it's a perfect environment for bacterial growth. Some of the causes that can cause swimmer's ear are when you have prolonged moisture, humidity, and heat within the ear, such as when you have water left in your ear after you go swimming. And then also trauma can cause the otitis externa, such as when you stick Q-tips in your ears and you cause trauma to the tissue. Symptoms of swimmer's ear are the following. You have pain in the ear. You also have a feeling of fullness inside the ear, itching, mild hearing loss, and you also have some ear drainage coming out of your ear. When the doctor examines your ear, he uses a little tool called an otoscope, and he will see that the tissue in your ear canal is swollen, and he'll also see some great drainage in there that, like in Jay's case, might be yellow. If it's not treated, the symptoms worsen, and then of course you also develop a fever, and the pain is you also have pain whenever the ear is touched. So next I'm going to talk about some of the treatments that they have for swimmer's ear. So when you go see your healthcare provider, they'll probably tell you to take some pain medication such as ibuprofen to help with the pain that you're feeling in your ear. Also, they're going to probably prescribe you antibiotic ear drops that you're going to put in either both ears or whichever ear has the infection for 7 to 10 days. If you still have the symptoms after the 10 days and you start developing a fever greater than 101 degrees Fahrenheit, you need to go back and see your healthcare provider so they can probably order you oral antibiotics or run some other tests on you. Also, that if this is left untreated and you just keep on going with the pain, there are some serious complications that can occur from the otitis externa. The infection can then spread to your eardrum, causing it to burst or causing inflammation to it. Also, that you can develop an abscess in your ear, and the infection can possibly spread to the bones that you have that surround your ear, which is a very serious complication. Will lead you to the hospital. So after the doctor, you go to the healthcare provider and they give you a prescription for eardrops. Now I'm going to show you how to put in the eardrops. First, you're going to wash your hands. Of course, always when you wash your hands, you always want to wash your hands before you do anything. Then you're going to warm the eardrops. So either you want to hold them in your hands for a couple of minutes, or you can rub them back and forth as well. If the person is over the age of 3, you're going to have the person tilt their head to the side, and then you're going to take, you're going to take the up top part of the ear, pull it up and back, and when you put in the ear drops, you're going to make sure when you put in the ear drops that you put it in the canal. Make sure you don't touch the tip to the actual ear to prevent any bacteria from getting in there, and you're going to put in the number of drops in their ear. You'll then have the person hold their head tilted to the side for about 3 to 5 minutes to make sure all the medication gets inside. You can also rub the little part behind their ear, the skin, to help make the medication go all the way through the canal. If it's a child under the age of 3, you're going to pull the little part right here, like where you put earrings, down and back because of the shape of their ear canal. When you're done, you're going to have to do, if you have to do it on the other side, you'll do the same process on the other side. And then when you're done, make sure when you put the cap back on the eardrops, you close it, and then you go wash your hands. Now I'm going to talk about some ways that you can prevent getting swimmer's ear. First, you want to make sure you never stick anything in your ear, never stick a Q-tip, and never stick a cotton swab in your ear. If you're going to use a cotton swab, only clean the outside of your ear. This part right here. Never stick anything in there, because when you stick anything in there, including a Q-tip, you can cause trauma to the tissue and you can lead to an infection. Also, when you're going to go swimming or when you're bathing, you want to try to make sure you can avoid getting water in your ear. If you do get water in your ear, you want to try to get it out. So you can either move your head, shake your head from side to side to get as much as the water out, or you can also use a combination of a 2-to-1 ratio of 70% isopropyl alcohol and acetic acid after swimming to dry the ear canal of water and to increase the acidity of your ear, which helps to prevent the infection. They sell pre-made drops in the stores. One brand is called Swimmer's Ear, and it also helps to prevent the infection. You also want to avoid swimming in polluted water, of course, because then this water that is polluted has an increased number of bacteria, and if you get it in your ear, then you can get an infection more easily.